This is Going Under. Anesthesia Answered with Dr. Brian Schmutzler. I'm Vahid Sadrzadeh. We're brought to you by the Butterfly Network.
All right, I'm going to let you in on something that's completely changed the way I practice. I've been using butterfly probes for years. It's a portable ultrasound device that plugs right into my compatible smartphone or tablet, so I can start scanning at the bedside in seconds. If you use the older versions, or even if you're new to the handheld ultrasound game, let me tell you why this new IQ3 is a game changer and really impressive. First off, having an ultrasound that literally fits in my pocket means I can move faster, whether it's vascular access, procedural guidance, or just getting real-time insights from my patients. And the tech inside this tiny device is pretty incredible. Biplane imaging lets me see short and long axis simultaneously, which is huge for procedural guidance and honestly a great tool for learners. The new needle out of plane preset even shifts the scan plane digitally so I can see the needle tip sooner, which makes a real difference when precision matters. And the image quality, honestly, the IQ3 holds up against some of the high-end cart systems I've used. That's impressive for something this portable. If you're looking for a device that supports your practice, I can't recommend the Butterfly IQ3 enough. And right now, they're running a special offer. You can get $750 off the latest IQ3. Check it out at butterflynetwork.com.
750 U.S. currency dollars.
There you go.
Every dollar matters, man.
And we want to thank Butterfly for coming to our CCI Chiefs meeting this past weekend. They brought in Russ Horowitz from Chicago, and he did a very nice presentation on POCUS and all kinds of preoperative stuff. So it was great. Yeah.
I like Russ.
Yeah.
We interviewed Russ back at the forum.
Yes. Yeah, he came up for us. So
awesome. Well, today I don't see your mustache. Are you working on a mustache?
I shaved this morning, actually.
I'm going to put one of those AI mustaches on you. I've tried a mustache.
No.
Yeah. Have you ever tried facial hair?
Oh, yeah.
Have you?
Yeah.
Are there pictures that exist?
Probably somewhere, yeah.
Oh, okay. So we might have to get a few, Alicia, if you're listening.
I can grow a full beard in about a week. Oh, yeah.
Jeez. Maybe, should we try it?
No.
I mean, not we, you.
No. I have to go on sales calls. I have to do all kinds of presentations. I can't have a full beard.
Okay, we will just AI one.
That's fine. You can AI a beard
for
sure.
For the podcast.
So why are we talking about facial hair?
Thanks so much for inquiring about that. It is No Shave Movember.
There we go.
Movember.
Movember.
As my kid would say, moo.
I don't know what that means.
Well, he watches Baby Einstein, so it's moo. He knows cow. Moo.
Oh, you're not talking about your 11-year-old or 12-year-old. You're talking
about my 1-year-old.
Okay.
My 13th month
I thought
old.
it was some like fancy new Gen Alpha, like 6-7.
I made the joke of saying, hey, should I say 4-5 instead and start a new trend? And he said, no, you're just embarrassing me and sound like a dad.
Yeah.
I'm like, okay. Sounds good. Well, No Shave November has been around for a few years now.
22 years?
2003.
Yeah, so this will be the 23rd year.
And it started in Australia as we did our research. You did a research. But actually explain this, though, that it actually has nothing to do with November.
Correct. So Prostate Cancer Awareness Month is actually September, which we found out in doing research for the show today. But I had always, because all the urologists talk about it and stuff, I had always thought November was Prostate Cancer Awareness Month. It's not. It's No Shave November or Movember. Started in Australia in 2003 to highlight men's health in general.
Mm-hmm.
And so a huge part of men's health, aside from the basic killers of heart disease and diabetes, is prostate cancer. So November, no Shave November, Movember is created to highlight not only prostate cancer but also testicular cancer, suicide awareness, and then there was something else as well.
I got you right here.
You do.
Faith, identity, and masculinity.
Oh yes, and men's mental health.
Absolutely.
Yes. So what we'll do is just maybe talk a little bit about the prostate, what it is, kind of just very high view, high level, what it does. This is a PG rated show, so we won't talk too much about all of it, but and then talk about prostate cancer in general. So the prostate, go ahead.
The kind of a setup to that.
Yeah.
I have to give a shout out to my physician. Love him. Been going to him since I arrived in South Bend 10 years ago. And I have to say, look him up, Dr. Vic Maida.
Yeah.
Love him. He's a great physician, great doctor.
We were talking earlier. He offered you a prostate exam today.
I had my physical.
Good.
I had my physical.
Yeah.
And he said, well, you're holding up. You know, your little squeaky arm here, a little, rickety back there. Yeah, exactly. And he said, while you're here, do you want to do a colonoscopy? Or like do the
prostate exam.
Well, you could do blood work for colonoscopy.
Oh, the Cologuard. Cologuard. Yeah, I've done one of those.
I said that you did it.
Yeah, you filmed it and everything.
Yes, I did. And he's like,
not the process.
Some people
he filmed the box.
Some people have difficulty doing that, or like don't like doing that and shipping it in a box.
Yeah.
But you can do blood work too.
Yeah.
You can do blood work. So I said, hey, I'll do either. I don't care. But the Cologuard's cool. Like I know it from Ryan.
Yeah.
So,
you have to poop in a little like bucket thing.
Yeah,
it's not that bad.
And how quickly does it get results back?
It took about a week.
So colon cancer is another one that, right?
Yep. Yeah, it's not specifically
listed on
for
here
this month. Yeah. I mean, colon cancer is one of the biggest killers of males and females, not just males, and it seems to be happening in younger adults. But
he said, do you want to do a prostate exam while you're here? And I'm like, if you ask me that question, I'm going to say no every time.
Yeah, exactly.
I'm going to say no every time. Debunk the myths here. What is the prostate? What is a prostate exam? That's what I was going to set you up on.
Yeah, of course. So the prostate is a gland. It's involved, and I won't get into big details, but it's involved in the reproductive system and the urinary tract system, as well as the hormonal system. So, it produces the fluid, the seminal fluid. So, that's what obviously comes out. And then also it acts as like a valve between the reproductive system and the urinary tract so that you don't have things going where they shouldn't go. And you can sort of imagine the rest. But as we age, some things happen, right? So almost every male, the prostate starts to enlarge. It's a gland like any other gland, and it's based on hormones. So as we get older, it enlarges, and it can restrict the urethra where the urine comes through. So if it does that, you don't get all the urine out, and so that's why men wake up in the middle of the night and have to go to the bathroom and don't completely eliminate the urine from their bladder. So that's number one. Number two, prostate cancer is fairly common, and so that's not. It's a bit of a newer thing, but it may just be because we are living longer. Mm-hmm. And so at least the statistics I learned when I was in medical school is 50% of men over 50 have prostate cancer, and 80% of men over 80 have prostate cancer. So as you age each decade, it's a 10% higher chance that you're going to get prostate cancer. Now, that doesn't mean it's clinically significant prostate cancer, though. So you can have prostate cancer and it not be something that is going to affect you. And again, it's another adage, but more men die with prostate cancer than from prostate cancer. Oh. So if you look at an autopsy on somebody who's 90 years old, they probably died from heart disease or diabetes, but they also had prostate cancer.
Interesting. So it's not, you can obviously die from any cancer.
Correct, yeah.
But what does it, what are the symptoms, I guess?
Yeah.
How do you know?
So the symptoms are actually similar to BPH, or benign prostatic hyperplasia. So the same thing, you can't fully urinate. Oftentimes there's blood in the urine. That's kind of a big sign. But I think they're recommending now that most men get a prostate exam to see if it's enlarging, and that's a digital exam. So a physician will, through the rectum, feel your prostate. That's the way the prostate exam works. It's a pretty basic exam, and I've done them when I was a medical student. I haven't had one myself. And then there's a lot of debate in the literature whether you should get the marker for prostate cancer. It's called PSA, prostate-specific antigen. So that's just a blood test. But, sometimes it's off, and then sometimes if you're not symptomatic, you might find out you have a very small cancer, and then what do you do? So a small cancer may never progress to anything, but then you're going to have a big procedure to remove the prostate,
right,
which has a lot of side effects. So there's lots of debates in the literature about that. So prostate cancer itself doesn't usually kill you, right? The cancer metastasizing is what ends up killing you. So it'll metastasize to bone, it'll metastasize to liver, it'll metastasize anywhere where the blood from that goes through the prostate goes back to. So bone is probably the most common. You get lytic lesions, like the bones break. So that's kind of where prostate cancer comes from, or how prostate cancer kills you. So there's a lot of things that you can do. There's some medications that you can take. There are some minimally invasive ways. So there's transurethral resection of the prostate. There's this cryoablation of the prostate there, and then there's full-on prostatectomies, which you can do either robotically or you can do open. So there's a lot of ways that you can treat prostate cancer, but the mainstay is getting the prostate out, getting that cancer out.
Is this I know a lot of, and what my physician told me was, you wait till you're 45 to get the colonoscopy.
Correct.
Is this the same thing with the prostate? Do you wait till you're 45? Yeah. Because more likely than not, insurance will.
Well, yeah, I mean,
or they won't let you do it before 45 with the colon.
They'll let a rectal exam, a prostate exam. You can get that anytime. That's just part of a
routine.
Yeah, routine. Yeah, and so I think at least my direct primary care physician recommends it at 40. I haven't done it yet. I don't know exactly what the literature says. It used to be 50. It may be 45 now. Probably is because you're 45, right? So
2 weeks.
Yeah. I'm guessing it's 45.
Thanks, man.
Yeah.
Appreciate it.
Yeah. So
thanks.
And that's a completely non-invasive exam. It's not very specific. It's basically like, okay, we feel what the prostate feels like. Is it larger than normal or not? And then if you kind of have those every year, you can tell, is it growing? And if it's growing rapidly, it's unlikely to be that BPH, that benign prostatic hyperplasia. It's more likely to be a cancer.
What would you do in that situation, though, if you had that small mass and you're like, it's not? I mean, do you wait? Do you?
I mean, there's a lot of side effects to prostatectomies. So, I mean, if you is
that surgery through the rectum, or is that?
It depends. There's a bunch of different ways to do it. So, I mean, if you can live with the fact that there's a cancer in there and that's not going to bother you, typically people wait till the PSA hits a certain level. And I'm not a urologist. I think the level is like 7, where they start to talk about options. But there's medication options as well, so you can do that even before your PSA hits a certain level. So, I think it's good to highlight. It's good to think about. It's good to know. Every man is going to have prostate cancer. It's just the way it is. Or prostate issues, not prostate cancer. Every man's going to have prostate issues, whether it's benign or not. So it's good to talk about it. I think testicular cancer is another interesting, because this isn't actually Prostate Cancer Awareness Month, we'll talk about all the other ones too. So testicular cancer is another interesting one. There's sort of these two times in your life where you're likely to see prostate cancer. It's sort of in that late teens, early 20s. Then again, as you get older, in the 60s or 70s. Testicular cancer is almost 100%. It's probably like 99% treatable. And the best way, honestly, to make sure that you're screening for it is self-examination. Mm-hmm. So you actually feel your testicles and make sure there isn't a lump that you didn't notice before. And then if there is, the treatment is orchiectomy, which is removal of the testicle. And then oftentimes they'll do also what's called a RPLND, or retroperitoneal lymph node dissection, where they go in and take out all the lymph nodes where it could metastasize. And so a lot of this was done at IU, Indiana University, where I trained. They developed the protocols for the chemotherapy for testicular cancer as well as the surgeries.
Interesting.
Yeah, it is very interesting.
Like that is nothing to take lightly. Again, I'm not going to go into too much detail here, but I've had some issues over the years, and it was one thing in my teens that I think I ignored.
Yeah, maybe.
Not cancer.
No, right.
But that I ignored. And then as I got older and into college, couldn't avoid the pain.
I see, yeah.
And so at that point, they needed to do emergency surgery.
Yeah. Yep.
And so, again, nothing to take lightly. I think you got to check it out before pain gets too much, before it limits you, and right. But it's something that I've always been aware of, something that I think all men should be aware of is, hey, like, am I feeling pain? Is it normal? Is it something that I should be aware of?
Yeah. So I think we as men in particular avoid our health issues.
100%.
Right. So
I'm one of those guys.
Yeah,
I mean,
and I think that that would bear the data would bear that out. Right. That men just don't go to the doctor. Yeah. And by the time you do, you're so sick that usually it's either your significant other dragging you in or you just fall out in the street. Right. So I think it's a good using the month of November to really highlight men's health issues. And then talk about it's okay to go to the doctor. It's okay to say, like, I'm sick, or
I mean, it's time consuming, but but you have to do it.
I'm sick, I'm having pain, I need help with whatever. And men just aren't good at that. We also aren't good at maintaining our health. And this is something, Friday I'm going to go in and have my VO2 max, my resting metabolic rate, and my DEXA scan to see how fat I am. And so I'm sorry, body fat percentage. So I think it's good to do the preventative stuff too, right? And just like every other cancer we talk about, the number one modifiable risk factor for any cancer is
smoking.
Smoking, right?
And smoking.
Yeah, smoking is number one, and then weight. Obesity is the other one. So if you avoid smoking, you significantly decrease your chance of having a severe metastatic prostate cancer.
Quit
smoking.
Something that I do want to bring up is heart problems.
Yeah.
Because I think that's another thing that is avoidable-ish.
Not completely. There's a genetic factor to it.
But you can, if there's warning signs, right?
Oh, yeah.
I had warning signs 3 weeks ago.
Yeah.
I mean, they weren't warning signs, but they were concerning signs.
Right.
And I think, like, as men, and I'm just talking to you as a guy, like, as men, we're so busy during the day.
Yeah.
And you're like, it's just stress related,
right,
or it's just whatever. And then you start feeling a little tingling down your left arm.
Yeah.
And you're like,
maybe not.
Maybe not.
Yeah.
And then you're like, ooh, well, I got a little chest situation.
Discomfort, yeah.
That is exactly why I called my doctor and said, I may need to just get in.
Yeah.
I need to get in, see what my physical's at, see where my weight's at.
Yeah.
Which wasn't good. and just kind of test the things that I've been ignoring for the last year.
Yeah.
Because what you don't want is to catch the things after they happen.
Yeah.
Because typically it's bad if that does.
So any chest pain at all, you should get in and see somebody. Now, unless you're having other symptoms with it, most chest pain is not cardiac, is not a heart attack. But any chest pain at all is an indication that something's going on. So you should get in and be seen as quickly. I'm a doctor, but not your doctor. So I'm not saying don't go to the ER or go to the ER, but you know your body. You got to get it. You got to get any chest pain checked out. Again, diet, exercise, making sure to keep a healthy weight, making sure to exercise. I advocate for, and this is not fully data based, but I advocate for an 81 milligram aspirin over the age of 40.
So I asked my doctor about that.
Yeah,
because I started taking it.
What did Vic say?
Vic said he's not totally against it.
Yeah,
but there have been studies recently that have shown that if you do take the 81 mil, that you have a chance of bleeding a little more because obviously it's supposed to
so
open up the vessels.
There were a couple good studies 10, 15 years ago that said taking an 81 milligram aspirin every day doesn't have any real side effects, right? I mean, it does change your platelet. It works by changing the way that the platelets aggregate. So you're going to bleed a little bit more, right? So when I get a blood draw, I bleed through a Band-Aid and then I'm fine. No big deal. But it probably reduces your risk, not of having a heart attack, but if you have a heart attack, of dying from the heart attack. So that's
because it'll open the vessels just a little bit more.
The blood is just thin enough that it's probably going to get past it and keep you alive. Now,
that risk? It outweighs the risk of bleeding.
The benefit out. So for me, yes. If you're somebody who's in a job where you're cutting yourself all the time, or you have another bleeding disorder, probably not. But for me, I mean, bleeding a little bit more if I cut myself shaving is not that big of a deal to me.
To me, this is well worth having the conversation.
Yeah, I think so.
Because, not just, I think as men, you're like,
Right.
I'm 45, big deal.
Right.
45's
but
not.
It could be something, right? So you should see a primary care physician every year. And if you're having symptoms, you should get them checked out. I mean, don't ignore it, I guess is what I'm saying.
Well, and we learned a great lesson with our friend here who had the transplant surgery.
Yeah.
And, he was...
Dave Schrock.
Yeah, he was, it was the symptoms, right?
Yeah, 45, relatively healthy guy. Just turned out he had
which is crazy.
Yeah.
So, I mean...
Any swelling that, if your legs swell... That's kind of a big deal. You want to get that checked out. It could be nothing. It could just be, you've got incompetent veins that aren't pushing the blood back, but it could be heart failure.
It is so easy, and I'm just going to admit this.
Yeah.
It is so easy to chat GBT something now.
Yeah.
That I did that. Literally, I'm sitting there at night having chest pain and like, gosh, did I have too much salt?
Yeah.
Or like, why are my fingers kind of swollen?
And you asked Chad, huh?
And I went to chat GPT. I'm like, type in the symptoms.
Yeah.
What should you do? And literally chat GPT said, you should go to the doctor.
Yeah, okay.
You know what I mean? Like schedule with because it is not, some of these symptoms are not normal, right?
Right.
And so
chest pain is never normal.
So that's the first, when I started having the chest pain with the left arm.
Yeah. Then you thought about it.
Then I'm like, okay, I'm going to get some 81 mil.
But you
and that helped a little bit.
You talked about how the chest pain was not, it didn't feel like the classic
somebody's sitting on
your chest, right? It felt like, I've got a
because I asked you.
Yeah, I've got pinpoint pain right here. So
I mean, one of my best friends is a physician, so but not my physician.
No, not your physician, and I'm not that type of physician.
Correct.
So.
But just to get that initial, but not everybody has that.
Right.
And so it is good to know those. Okay, does it feel like somebody's sitting on your chest?
Right. Yeah.
Didn't feel like that.
Yeah, that's one of the classic. In men, in women, it's totally different.
Really?
Women oftentimes have silent heart attacks, so the only thing they notice is like jaw pain.
Wow,
my
that's
left
scary.
jaw hurts. And a lot of times it's a heart attack.
So when we boil it back down, though, get your physical every year.
Yep.
Listen to your doctor.
Yep.
The other thing I wanted to bring up with this Movember is that the mustache represents more than just no shave November.
Right. Yeah.
It represents standing for men's health.
Yeah. It's kind of a virtue signal, not in a negative way.
Yeah.
It's kind of a virtue signal. Like I'm not going to shave this month to show that I care about men's health. And specifically we think prostate cancer, but like you said, testicular cancer, mental health, all that sort of stuff that men often deal with and don't talk about.
Mental health is a big deal too.
Yeah, absolutely.
Which I don't think, is not talked about.
Nope. Yeah.
By far is not talked about more than any other, and we can say it, killer of men, of women, it always gets to somewhere too far.
Yep.
I was one of these people that I don't really need to, I'm just chalk it up to stress or chalk it up to whatever. But again, you don't want to get it to a point so far where you can't control it, where you can't, and that is the worry, right? And so talking about mental health.
Yeah. There's a stigma. I think there's a stigma related to it.
Is there mental health? Just a serious question.
Yeah.
You have a lot of professions where mental health is a big deal.
Yeah.
Right? Let's talk about medicine for a second.
Yep.
How often do you find people are not talking about mental health, and how big of a deal is it in the medical field?
Yeah, I think there's a stigma to it, particularly in the medical field, because you're expected to be the one taking care of other people, and so a lot of times if you say, "Hey, I've got depression, I've got whatever," there's stigma in the medical field, and a lot of times people talk about like they lost a job or didn't get a job or something like that because they talked about their mental health. Add to that in medical school and residency, it's cutthroat. It's very difficult. It's very time consuming. You don't have time to take care of yourself. You don't have time to see your family. I think, the suicidality and mental health rate is a little bit higher in physicians than it is in the general public. Not 2 times.
Astronomical, but it is more.
A little bit higher, yeah. But it's very, very stigmatized where people don't talk about it.
If you will allow me to, I will post a story I did.
Yeah, of course.
And this is another profession, football.
Yeah.
On CTE. I did some research a few years back, and now the technology has doubled or tripled
with the Guardian caps and stuff. Yeah,
have tripled since then. Yeah. But I did a study, and I talked to some physicians locally, and did a very in-depth report on CTE.
Yeah,
that I think is really important.
Yeah,
because again, we're young men who are 24, 25 years old.
Yeah.
Who are losing their life because of mental health.
Junior Seau, right?
Junior Seau. He was one of the first that we knew of when we kind of diagnosed that CTE. When the medical world was like, okay, we're going to recognize this.
Well, there was that kid from Dallas,
the Dallas Cowboys.
He committed suicide too.
A couple weeks ago.
Yeah,
and I think his brother had died previously.
Yeah,
and so again in football. What are you going to do? Go to the head coach and be like,
depressed. Right. Yeah.
Right? I mean, talk about those things.
Yeah.
And so I feel like there is a side that, I'm glad that the University of Notre Dame has psychologists that they have on staff that can help kids with that stuff.
Yeah. It's
somebody who played football.
Yeah.
And somebody who played sports, right? Yeah. It's not like
it's not talked about.
It's not talked about at all. I mean, it wasn't talked about in 03, 04, 05, whatever. Like that, certainly not talked about.
It's interesting. The one of the biggest things is that leads to poor mental health, worse mental health and suicidality is isolation, right? So not talking about it, right? And I think a lot of men are isolated, especially now. There's a lot of men who are very isolated. If you don't have a significant other or kids or a really good set of friends, it's very easy as a man to go, like, I go to work, I go maybe to the gym, and I go home by myself, right? If you don't have all that support system. And I don't think, women are much more, in general, this generalities, women are much more interactional, right? They'll find other women to hang out with. They might
talk to.
Right, yeah. So I think isolation within men is a big problem, and that also probably leads to worse mental health issues.
I mean, it's a big deal in a lot of professions. It's a big deal in television because the stress, like you go home and you don't really want to hang out with anybody else because you're just
all day long.
Yeah, so it's like, I feel like there's professions that, physicians, TV, journalism, football, whatever. Look at these little pockets. Those are just examples.
Yep.
Not saying it's everywhere. It is everywhere. Yep. But those are just little pockets that's not talked about.
Yeah.
And so I feel like, why are we only waiting till 1 month to talk about this stuff? You know what I mean?
Like, that's true.
And I think it's really good what you guys do, once a week is it once a week or once a month with the men's group?
Once a month. Yeah. Men's groups once a month at Influence. Yeah.
And I really think that's a great thing because, I don't know if you talk about these things, but it's a support group.
Yeah.
That you can have a voice in, that you can have a listening ear in.
We talk about our struggles, probably not to the level that I would talk to like a best friend, but we talked about our struggles in general. And it's nice to know, you've got, other people there who are, like-minded and stuff. So yeah, it's a men's group is good. And any time that you can put together a bunch of men together, I think it's helpful for the mental health aspect of things.
So there are some other months of the year.
All right. There's 11 other months of the year.
Always have a friend to keep you in check.
That's right. So what do the other months mean?
So November is awareness.
Yep.
January is New Year Health Reset Month, which that's why you see your gyms packed.
Yeah, that's right.
On January 1st.
Until January 20th
I'm making a stand next year.
All right.
2026. 2026.
Come work out with me. Come work out with me.
Deal. March is colorectal cancer month.
Okay, yep.
So that is March.
Yeah.
And then September is officially
prostate cancer awareness
month.
But it's just not. It's not like so. October is breast cancer awareness month because they partnered with everybody. You've got the pink and all that sort of stuff. I think that nobody knows that September is prostate cancer awareness month. Everybody knows about No Shave November or Movember or whatever. So that's the the month that we really promote it. So.
Well, I'm going to expect that AI mustache on you.
Yeah, that's up to you. You're going to have to put that on there.
I will.
That's not me.
At least we will for the reel.
Yeah.
The social media reel.
Yeah.
But I'm not going to grow a mustache.
Okay.
And it's not because I don't stand in solidarity with other men about
We're also
raising awareness.
halfway through the month already, so.
I needed to start that back in
shaved
March.
Today. I shaved today.
I needed to start that back in March.
Yeah.
But, if you want to see me on the next kickoff show,
there you go.
I won't have a mustache.
Yeah. Couple little straight hairs.
Yeah, that's gonna look weird. But maybe for the
Playoff game.
Maybe for the playoff game in January.
Yeah.
But here is what we're gonna leave you with: challenge yourselves.
Yeah.
Share this episode with other men.
Yes, absolutely.
With other people in your life. Schedule a checkup.
Yep.
Ask your brother, dad, friend when he last had a PSA.
Yep.
And
or a prostate exam, either one.
Prostate
or both,
exam. And grow a mustache with purpose.
I promote all of those except the mustache portion. I will not participate in that portion.
You know
of
what?
it, but.
Maybe we will. Oh, man, now I'm wishing we had Bronson on the show.
Yeah,
he could grow a mustache in 2 seconds.
Yeah. He's got a full beard.
Maybe we'll just post his picture.
That sounds good. Yeah, he's participating.
Anything else on this episode?
No, I don't think so. Just like we said, we care about health in general, and we definitely care about men's health, and so this month, highlight it.
Awesome.
Yeah.
Well, take care of your guys out there.
That's
and
right.
take care of yourselves if you're listening and watching. This has been another episode of Going Under, Anesthesia Answered with Dr. Brian Schmutzler, brought to you by
the Butterfly Network.
And
Movember.
Yeah. We'll see you in the next one.
All right, see you in the. Oh, I was supposed to say see you in the next
Well,
one.
you jumped at the chance last time, so I was giving you the microphone.
We'll see you in the next one.
Enjoy No Shave November.